So moving forward in the COVID-19 response, there's a few areas of focus for us, and it spans a range of needs and priorities that we've identified in the work we've done, and that continue to be areas of focus and areas of need as we look at the upcoming months of this response. So of course, like we highlighted earlier, there are communities that are facing more disparate impacts because of this response. The Black and Latinx communities have dealt with a higher rate of severe illness and worse outcomes due to COVID-19 because, again, there are overlapping needs that we've identified, whether it be higher rates of chronic conditions like diabetes and asthma and hypertension that make it harder for people to recover from COVID. But then we cannot ignore the structural challenges that exist in these communities that put people in higher and greater risk of actually contracting the virus. If they're not able to access, if they're not able to stay at home and have teleworking capabilities, they're more at risk for still being in an office, still being in a workplace where they're being exposed to a lot of people. If they don't have the supplies or the financial situation, the financial security to really tend to their health, that can make them, that could be a priority that is on the back burner. So we really know that in these communities of color, it's not something we can ignore. And so we continue to focus and support on how we can actually support these communities, not just identify the needs. And really often it is about extending partnerships beyond silos. Of course, there are organizations that are already doing great work in these communities. So it's about making sure that they have information on the healthcare system and the challenges that exist at a disaster level if they have never had to deal with that at the level that we are all dealing with it right now. And there is always a need for enhanced coordination. That's kind of the pinnacle of emergency management, is coordination and communication. And so essentially we're still focused on the supply chain in a lot of ways, and supporting coalitions and making sure that the challenges that are facing pharmaceutical companies and being able to provide supplies and amp up production where appropriate, and make deliveries if they're a distribution organization. We are continuing to provide the information, the analysis, and the administrative and logistic support that allows these groups to do their job. And cross-sector coordination does not go away as well, because while we have the supply chain that exists and can respond to disasters, there's information that is needed to be transferred to the federal government, the local governments, the state governments, to actually understand what the healthcare system is facing and how they need to support with updated policies, updated strategies to facilitate these responses and these activities to disruptions. And of course, we are really looking at the long term here. This has not been a short response, and it's not going away anytime soon. We've been activated for weeks, months at this point, and we will be activated and working indefinitely until the healthcare system is at a different place than it is right now. And so we're still responding to these strains and recognizing that there are new challenges that are coming up as we move forward. And this includes, of course, the hurricane season that's upcoming, and looking months in advance to flu season, and how the overlapping disasters will present challenges that are unique, and we essentially cannot ignore them. Same thing with reopening, and the fact that many states at the point we are recording this are now reopening economies, opening up stores, and relaxing some of the stay-at-home orders and social distancing measures for economic reasons. But that of course means that there needs to be an extra vigilant public health response as we look at potential spikes in cases and potential need for increased resources and supplies to allow people to actually navigate these reopenings without running the risk of creating new hotspots and creating new spikes in cases.